Trinace Edwards was laid off from her job a year ago today. 6 months ago, she was diagnosed with a brain tumor. She couldn't afford insurance on the individual market, so she hasn't received treatment yet. Her daughter, Lanace, a student at the University of Maryland, is considering dropping out of school to help pay her mom's bills. Well, starting today, thanks to the Affordable Care Act, Trinace can get covered without forcing her daughter to give up on her dreams.
That was the president, obviously, and that was yesterday, doing what he's been really, frankly, struggling to do since he started this debate in this country over health care reform. Put a face on it. Use real examples of real people finding real benefit from the Affordable Care Act. Well, we asked our cameras to go out and try and put human faces on this as well, and Files One did that just yesterday when it went to an event on Long Island aimed at helping people sign up for what's known as Obamacare. Only we heard it directly from the people themselves.
They actually said I was eligible for Medicare, or Medicaid, or Medicaid, Medicaid, and I was very surprised by that. So I'm going to go home, put the finalizations on it, get whatever information they need, and hopefully start a new plan. Unfortunately, I'm unemployed, and I had to get my own insurance through Healthy First, and actually today is the day I'm supposed to pay for the next one, and I need to see if I need to pay for the next one, or if I can enroll in this today, if it's going to be cheaper than what I'm currently paying.
There were a lot more other examples that we found as well. In the first 24 hours, the Obamacare health exchanges were open. Nearly 3 million people visited the website healthcare.org. A facilitator in Jersey told USA the phones were ringing off the hook, and they called the activity in its office frenetic pandemonium. Those are their words. New York system got 2.5 million hits the first 90 minutes it was running, and 10 million hits all told yesterday. And it wasn't perfect. There were glitches with the system. Many people argue day one of anything you're going to find glitches, but the critics will point out here that, hey, this didn't work as well as it should have. It's Exhibit A, that this is flawed. I say give it a little bit of time. The broader question is, do you think 6 months from now that there'll be more stories about frustrated small business owners or people being forced to buy something they don't want and the fines? Or do you think there's going to be more stories about people saying, you know, this pre-existing condition that I found myself saying the only alternative was the ER, now I can actually go see a doctor here in an office, etc. Which one do you think we're going to see more of?
Oh, I'm very confident you're going to see more of people saying, all in all, I have one little bit of security I didn't have before, which is that I can go to a doctor, I can see somebody for preventive care. I'm not worried about going to the emergency room. I'm not worried about getting sick, period. I think it is going to be a remarkable success. And I think the people you interviewed show you there's a tremendous appetite for the security of health care. And it runs from young people to old people. I'm having a forum for small businesses next week in Yonkers with the Westchester Business Council to educate them. They're not coming out of hostility. They want to understand it. It's a new law. It's a new change.
We had yesterday with us an argument from somebody who said, a former congressman who said, hey, what happens if you got 52 employees? They're going to say, I can't make you full-time anymore. I'm going to pay you 25, 30 hours a week here. I can't make it, I can't cover my nut if I do that. You don't have to name names of businesses. Is that real or is that overhyped, do you think?
I think it's overhyped. I think there will be a process whereby small business particularly are going to struggle with some of the provisions. But all in all, this is a bill that makes their employees better employees because they have coverage. That is a remarkable change for a small business. You know, any small business where you know the person is going to come the next day and can see a doctor and get their antibiotic. Last
question, and as much as you can make this relatable in your district, you have a hospital in your district as well.
Yes.
I know from people close to me in the hospitals, even hospital presidents who believe that being in the premise of this, that they still say there are so many unanswered questions still with the implementation of this, and also still some unfunded mandates, if you will. You must hear concerns from hospitals. Are they half pregnant on this thing here, or are they clear when they try and put their numbers and budgets out what this will or won't cost them?
Look, hospitals are never clear because they're extraordinarily dependent on Medicare and Medicaid reimbursement. Take aside the Affordable Care Act. So they don't live in a certain environment. But all in all, they are going to benefit by a vast number of people being insured as opposed to uninsured, and uninsured from whom they cannot collect, and they never collect the full amount of the amount due. So this is good for hospitals.
Andrew, this isn't fair because you already know the answer here, but I want to do, because to me, we were talking about this earlier, this is not about, this fight we're having in Washington, we said it's philosophy, but it's not really about Obamacare and the elements of it and the medical device taxes and all that. Trust me on this one, it really is not. Now, I'm going to read you a few quotes here, and then we're going to give a little bit of perspective as to what we're talking about. Let's, if I'm not screwing this up, guys, thank you. The beginning of socialized medicine. It will lead to deteriorating service. Bureaucrats will invade the privacy of the examination room. It'll put the U.S. on the road to ration care. Patients will lose freedom to choose their own doctor. Now, leave that up for a second. All of those statements, we've heard these almost verbatim in the last 6 months, 2 years, 5 years. Ever since the president talked about Obamacare or Affordable Care, whatever you want to call it, we have heard these arguments. Okay, well, it turns out, while you've heard those words, all these quotes were taken from a different time. They said this about Medicare. This is where you see, obviously, Lyndon Johnson signing Medicare and Medicaid into law, and I defy the politician who wants to repeal that now, but they said all those same things about that. And by the way, to Johnson's left in that photo, 81-year-old Harry Truman, who first called for the expanded health care back in the 1940s. Or what about the claims it's a job killer, it's socialism, remember that? It will end the progress of a great country. Well, those are what critics had to say about Social Security in 1935 when then President Roosevelt signed it into law. Andrew, my point is, if you close your eyes, the same exact thing said at different eras in American history about arguably two of the most popular entitlement programs that we have in this country.
We were talking about that in our editorial meeting this morning. We came up with the idea. And I went through and I did the research, and I went back through old copies of the New York Times, and I went through old magazines, and I couldn't believe what I was seeing from the critics.
Why not? Why not?
Because
not
it was
surprising at all.
Because it was the exact same thing we'd heard. They haven't even updated the script
No
in
offense
80
to our
years.
officials here, but some elected officials don't know what they're talking about.
Oh, I know they don't, and they're just reading off the talking points. But the script hasn't changed in 80 years. I mean, I remember Ronald Reagan, and I remember seeing this, he cut a record, an LP record that people listened to in the 60s about the dangers of socialized medicine. I mean, that I knew, but that it would be verbatim from 1935
I don't know
and
how many,
1965?
but if people saw that and they understood, and there was a good piece, and I'm not going to do it justice, but the paraphrase was, they said, wait a second, if this thing's actually popular, like the Assemblywoman says, and people really buy into it and say, hey, wait a minute, my life's better now. My life's going to be better now.
It's already popular.
That's going to take away yet another sliver of the GOP. And when we all look at the racial makeup, the white population that made up the GOP is now bigger than it was before, and obviously you have a shrinking white population in America. They can read the demographics. They know this is a problem. If this actually works, it's going to hurt them, and I think that has a lot to do with this, as cynical as that sounds. Now,
That's a quote from Ted Cruz,
Yeah.
that people will like it so much that we won't be able to
the
take it away from
sugary
them.
sweet stuff, or whatever
Exactly.
we called it.
Exactly.
All right, now, we know, Dominic, a lot of this has to do with the marketing of this. From a political standpoint, is that this thing's confusing. And of all people, it led to late night comedy to just show how confusing. Jimmy Kimmel last night.
So Obamacare is un-American?
I think it's kind of un-American to force people. What if they can't afford it? What if they want more coverage?
And the Affordable Care Act is American.
I think it's more American because it allows people to make their own choices on what they want and who they want to work with.
Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
So you disagree with Obamacare?
Yes, I do.
Do you think insurance companies should be able to exclude people with pre-existing conditions?
No.
Do you agree that young people should be able to stay on their parents' plans until they are 26?
They should be able to, yes.
Do you agree that companies with 50 or more employees should provide health care?
I do.
And so by that logic, you would be for the Affordable Care Act?
Yes.
What plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And why do you support that over Obamacare?
Do not like Obamacare. I don't like anything that has to be forced for everybody to buy. This is not good.
Do you think Obamacare is socialist?
Yes, I do.
Do you think the Affordable Care Act is socialist?
No.
Of course, the Affordable Care Act is Obamacare, the exact same thing. They're just called two different things. And Dominic, as much as it's a joke there,
It's
what
sad.
they're trying to do,
It's sad.
But it's also an indictment on the marketing of
It's
this
sad.
president, that after his signature issue, he never sold right. Now, he's got one more chance, and I think the Republicans have given him an opportunity.
They were going to slam this president no matter what he
Okay,
did
but
on
it's
this,
on
Richard.
him to the general public to explain what they're getting or not getting.
Right.
You had a guy saying, "Oh yeah, pre-existing conditions, you shouldn't kick somebody out for that." 26, I want to keep my kids
That's
there.
a result, what we just saw right there, that's a result of Fox News. And that's what part of the problem is on this. Hear me out for 1 second. Lawmakers, we don't even have to agree on the news anymore. You can get the news based on what your political point of view is. So you could turn to a Fox, and some of my friends are there, but you can turn to a Fox and they will spin this and tell you, if logic doesn't have anything to do with any of this, they'll just tell you exactly what you want to
The
hear.
best example of that is yesterday we saw those vets coming from Mississippi, World War II vets, and they came to go see the World War II memorial. By the way, if you haven't seen it, you should go see it. It's a beautiful memorial. And in front of the gates were two Republican lawmakers who said, Steve King from Iowa being one of them, who said, the damn government's not going to keep you out here. This administration's not going to shut the door on us. They're the ones who shut down the government, but it's the president's fault that the gates are closed.
But it's all in a spin. Because they will say they didn't shut it down. The president refused to work with us, so he shut it down.
I still think you're giving him a little bit of a pass here. Shame on the folks who twisted the facts, but it's incumbent on him. If this is what he wanted to do, no one made him reform health care, but if he wanted to do it, he needed to be more committed and sell it better. I think we did a better job at the table tonight talking about its benefits than for 5 years I've been hearing from the administration.
Well, let me just say this. I think from the get-go, particularly when the bill was passed, it was not explained well during the legislative process. I remember my mother said to me, "What is it really? I don't really understand." She read the paper, she still couldn't understand it. Once it was passed, there was a concerted effort by the government. I think it was bumpy.
Yeah.
There was a concerted effort to explain a complicated law. I mean, you can't explain Medicare in 5 bullet points either. This is a complicated thing. It had many different pieces. I don't think they did as well as they could, but I agree. They were going to go after him on this. Once they found they could twist it and make people think that somehow something was being shoved down their throat.
Socialism.
Notwithstanding, the bill passed. It isn't Obama's bill. The Congress passed the bill.
That's great. And the Supreme Court even gave it
And
the
the Supreme
green
Court
light.
upheld it.
All right, when we come back, we're going to leave Washington, you'll be happy to know, and we're going to come back to our neck of the woods here. We're going to talk some politics here, and many are saying now the Nassau County exec race could actually be a bellwether for how the elections may be going next year nationally. Also, did Governor Christie take revenge on a local mayor by unnecessarily closing a major road here? We'll explain after the break. Stay with us.